Welcome to the AEHR video training series presented by Information Technology Education at UK Healthcare. This course is intended as initial AEHR training for providers. This training consists of 4 web-based training modules which are required for you to complete in order to successfully complete this course. You may watch the modules all at once or individually over time as your schedule permits. You must watch the modules in the order in which they are presented. Once you have completed all of the modules, you must take a proctored in-person assessment to test your knowledge of the information presented here. If you pass the assessment, IT will grant you full access to AEHR. If you do not pass the assessment, you must complete the 4-hour in-person version of this class in order to gain full access. The classroom version of this course is also available to anyone who wishes to complete it in person rather than online. If you have questions about the process or the assessment, or if you would like to schedule an in-person classroom session, please contact the IT Education Department at 257-9226. If you will not be entering data into AEHR and only need view-only access, please stop this training module and search My UK for the AEHR view-only video. Once you complete this video, contact the service desk at 323-8586 to be granted AEHR view-only access. If you need access to edit and add information to AEHR, then you will need to complete the series of training modules you are currently watching. This training module is the first in a series of 4, and it is divided into 4 chapters. The first chapter will introduce you to AEHR. In this chapter, we will define AEHR and meaningful use and familiarize you with terminology specific to the program. We will also discuss access to AEHR, including logging in and logging off, and tell you how you can change your location or site within the program. AEHR stands for Ambulatory Electronic Health Record. Currently, UK Healthcare is using SCM, Sunrise Clinical Manager, as the inpatient electronic health record in our hospitals, and AEHR as the outpatient electronic health record in our clinics. Throughout this training, you will hear references to meaningful use. Therefore, it is important that you understand what meaningful use is and why it is important. Meaningful use is the federal mandate that states that every healthcare institution must be using an electronic health record to document patient charts. There are features of your notes in AEHR that are extracted and reported to the government for meaningful use. AEHR was developed with these extractable pieces of information in mind. Therefore, as we go through this course, I will point out to you the places where meaningful use requirements listed here will be important to you. The AEHR icon for the live system looks like a man in a green shirt and is labeled as AEHR UKHC. You will log in using your LinkBlue user ID and password, the same user ID and password that you use to log into email, SCM, and many other programs. Once you have entered your user ID and password, click the New Session button to log in. Do that now. You can also hit the Enter key on your keyboard to log in. UK never uses the Last Session button. Once you are logged in, it is important to remember that you should not ever leave AEHR open on a computer unattended. This is a violation of HIPAA. To avoid this problem, you can lock your system when you're walking away from it for a short period of time. To do this, click the Lock button in the upper right corner of the window. Click that button now. This will password protect your screen. Since you are the only person who knows your password, you are the only person who will be able to unlock the screen. If you need to use a computer that someone else has locked, you can click the Exit button. This will log them off and return you to a login screen where you can then log in. However, if you're returning to a computer that you have locked, simply enter your password to return to that screen that you are working on. When you are done using AEHR for the day, or if you are going to be away from the system for an extended period of time, it's very important that you log out using the Log Off button in the upper right-hand corner of the screen. This will allow the system to save everything that you've been working on and properly log you out so that you don't encounter any errors when you are ready to log in again. This is how your screen should appear when you log in. The menu along the left-hand side of the window is called the Vertical Toolbar, or VTB. The VTB contains different sections of AEHR. We'll use many of these sections throughout the course of this class. The tabs along the top of the screen are called the Horizontal Toolbar, or HTB. The Horizontal Toolbar contains subsections of the sections of the program listed on the Vertical Toolbar. Therefore, as you select different options on the VTB, the tabs on the HTB will change. Directly below the HTB is a large gray box. This box is called the patient banner. The patient banner will fill in with the patient's name, medical record number, date of birth, etc. once we select a patient. By default, the screen that will show for you as the first screen you will see will be the daily schedule, which is a schedule of patients that you will be seeing today. We'll discuss more about the daily schedule in a future video. There is also a floating toolbar that will appear on top of your screen. This toolbar is called the Clinical Toolbar. It's where you will be adding information to the patient's chart. This toolbar is always available to you no matter what screen of the program you're on. Sometimes it is floating, other times it is a docked toolbar. When the Clinical Toolbar is floating, you can move it around your screen by clicking on the blue title bar and dragging it. If it's in your way though, don't ever drag it off the screen completely. Instead, click the X in the upper right corner of the toolbar. This will hide the floating toolbar. To bring it back, select Show Hide Clinical Toolbar from the Tools menu in the upper right-hand corner of the screen. You can only hide the Clinical Toolbar when it's floating, not when it's docked. At the bottom of your screen, you'll notice the status bar. This bar will identify your user ID as well as the site where you are located. You are assigned a site when your account is created. Typically, this site is the clinic location where you work most often. However, if you work in more than one clinic, it's possible that you'll need to change your site in the program when you change physical locations where you are working. Your site needs to be correct so that the letterhead used on your letters is correct, the address and phone numbers on documentation for the patient is correct, the site printed on orders and notes is correct, tasks can be assigned to the correct site-based teams, and the correct exam rooms are options for the patient's location. Printing is also affected by your site. When you print, the printer that appears for you to print to by default is the printer associated with your site, not with your computer. So if you don't change your site, then it's possible you won't be printing to the correct location. To change your site, click on User Options on the vertical toolbar. Do that now. You can then select the specific location where you are working. Most clinics have set up their physical locations as separate sites. However, internal medicine created each pod as a separate site. Click to select the site you're working with today. To return to the daily schedule, click Chart on the VTB. In the next chapter, we will show you the daily schedule. This chapter will introduce you to the daily schedule in AEHR. We will discuss how to access your own schedule of patients as well as how to access other providers' schedules. We'll also talk about how to look at the schedule for dates other than today and show you how to view multiple providers' schedules. Finally, we will discuss multiple ways to select a patient and view their chart. To open another provider's schedule, click the All button to the right of the provider drop-down. Type the last name of the provider or the name of the provider group that you are searching for. If necessary, you can also put a comma in the first name of the provider. Then click Go or hit the Enter key on your keyboard. Select the provider that you're looking for, then click OK. Once you've searched for a provider, they will always appear in the provider drop-down list for you so that you can select them again without having to search for them each time. You can also use the personalized link in the upper right-hand corner of the screen to set a default provider whose schedule will appear by default every time you view the daily schedule. The daily schedule is the schedule of all of the patients who have appointments to see you today. The schedule is imported from the Ambulatory Practice Management System, known as APM, that is used for outpatient scheduling and registrations. The daily schedule displays a variety of important pieces of information. The first column is the charge status column. It will be blank until the attending physician submits his or her charges for that visit. Once charges have been submitted, a green $ will appear in this column. The N column is the note status column. It will be blank until a note has been started on the this patient for this visit. If a note has been started, an icon of a piece of paper will appear in this column. Once the note is finalized, the piece of paper will have a green check mark over it. As a resident, your notes need to be signed off on by a supervising attending. Therefore, even after you sign your note, the green check mark will not appear until the attending has signed your note. The TC column is for transition of care. Some appointment types are flagged in the system as transition of care. This implies the movement of a patient from one clinical setting to another. The SOC column is for summary of care. UK is not currently using this feature. The CS column is where the checkout staff will print a clinical summary for the patient at the end of their visit. The clinical summary is a printout that the patient gets to take with them at the end of their visit that shows them what they were diagnosed with, what their vitals were today, what changes were made to their medications, etc. Most of this information will come from your note. When we discuss notes in a future video, we will discuss the portions of your note that need to be completed before the patient leaves so that they can be included on the clinical summary. Checkout staff will click on the clipboard icon to print the clinical summary at the end of the patient's visit. The A column indicates the patient's arrival status. The patient will be in a pending status until they arrive and complete the check-in process. Once the front desk has completed check-in, the patient's status will change to arrived to indicate that they are ready to be taken to a room for clinical intake. The patient location column will indicate where the patient is physically located within the clinic, for example, in the waiting room or in an exam room. The patient status column will indicate where within the appointment the patient is. For example, if the patient is with the checkout staff or ready to be seen by a provider, that information will show up here. The time column will show the time of the patient's appointment. This does not show the time that the patient arrived or the time that they were taken to a room, but instead only shows the time the appointment was scheduled. The patient's name appears in the next column. The type column indicates the type of appointment that the patient is being seen for. This will typically be an EP for established patient or NP for a new patient. The duration column indicates the amount of time that was blocked off for this particular visit. The tasks column will show how many current tasks exist for this particular patient. Tasks are clinically relevant messages between employees about a patient's care. They will be discussed in greater detail in a later video. The comments column is a note from the appointment scheduler about the reason for the patient's visit. This may be something like follow-up or pre-op, but it may also be the patient's chief complaint. The names on the schedule will automatically refresh every 5 minutes, but if you know that a patient is not on the schedule anymore, for example if they cancel an appointment, or if there's a walk-in patient, you can refresh the patient list manually by clicking the refresh button in the upper right corner of the screen. By default, the system will always show the current date schedule on the daily schedule screen. However, there are multiple ways that you can select different dates. The Days of the Week banner at the top of the screen will allow you to view the schedule for other dates in the current calendar week. There are arrows directly to the right of the Days of the Week banner that will move the schedule forward 1 week if you press the arrow that points to the right, or back 1 week if you press the arrow that points to the left. You can also select a specific date by pressing the button that looks like a calendar that is next to the date display. This will display a window where you can select a specific date. If you click and drag the 3 lines in the bottom right corner of this window, it will give you more months to select from. From this window, you can also jump a definitive number of days, weeks, months, or years in the calendar. To return to the current date, you can always press the Today button. You can use the Provider Schedules tab on the horizontal toolbar if you want to view multiple provider schedules simultaneously. This will allow you to view up to 4 different provider schedules side by side. You can select any providers that you have searched for before from the drop-down menus, or you can search for new providers by using the All button. If you want to set default providers on the Provider Schedules tab, you may do that using the right side of the window that appears when you press the Personalize button. There are 2 ways to select a patient and view their information. If the patient is not here for a visit today and does not appear on the daily schedule for today, then you can search for them. To search for a patient, click the Select Patient option. Do this now. It is possible to search for a patient by name, medical record number, social security number, phone number, etc. The two most common searches are by name or medical record number. If you are searching by medical record number, be sure that you include all 9 digits in your search. If you leave off any leading zeros, the system will not find the patient. If you search by name, you can use a full or partial last name, then a comma, then an optional full or partial first name, then a comma, and an optional date of birth or just the year of birth. This can be helpful when you're searching for people with very common names. For those patients, it may be advantageous to search using the last name, comma, first name, comma, and the date of birth so that you won't get too many responses from your search. However, if you're dealing with someone with a difficult to spell name or someone whose name you're unsure of how to spell, you can use partial name searches to help you find the correct patient. Once you have entered your search information, press the search button or click the enter key to search for your patient. When the results appear, you will be able to double check the patient's information to be sure that they are the correct patient and then click OK. In this example, the correct patient is highlighted. Therefore, click OK to select this patient. You will now notice that this patient is the patient in context, meaning that they are the patient you are currently working with and they are the patient that appears in the patient banner. When a patient is selected, the patient banner will populate with the pertinent information about that patient. Their name appears in large letters on the left side of the banner. This is so that it catches your attention and you're always aware of what patient you are working with. So be sure to look here often to be sure you're working with the correct patient's chart. Also in the patient banner, you will find the patient's medical record number, date of birth, age, and gender. The patient banner also provides a quick reference about whether or not the patient has allergies. It will not tell you what the allergies are, but it will show unknown if allergies are not documented, no if the patient is documented as NKDA and does not have any non-medication allergies, yes if the patient has medication allergies, and NKDA if the patient has non-medication allergies but no medication allergies. The patient banner will also show if there is any security on any notes in the patient's chart. This typically happens with sensitive notes such as psychology notes. If the patient has a note that is secure in their chart, a break glass icon will appear in the patient banner. Clicking this icon will make that note visible to anyone with the rights to be able to view it. An R also appears next to the patient's name to indicate that there is restricted information on this chart. The patient's AKA or name that they wish to go by. It is good customer service to check this field before speaking to the patient so that you call them by the name they prefer to go by. Directly below the security, you will find the patient's primary care physician. Finally, the patient's home phone number also displays in the last column of the patient banner. All of the information in the patient banner comes from APM, so any information that is incorrect needs to be fixed in APM. The front desk staff at your clinic will have access to change this information. The second way to select a patient and make them the patient in context is to select them from the daily schedule. If the patient is here for a visit today, it is very important that you select the patient from the daily schedule. This will make sure that all of your actions are connected to today's visit for billing purposes. To select a patient from the daily schedule, single-click the patient you wish to work with. This will make that patient the patient in context. To return to a patient who you have viewed previously, click the Select Patient drop-down. Here you will notice every patient that you've worked with during the current login session. Once you log out, however, this list will clear out. In AEHR, a patient's chart is called their clinical desktop. There are 2 ways to view a patient's clinical desktop. You can single-click on the clinical desktop tab on the horizontal toolbar when you are in the chart section of the vertical toolbar. This will display the clinical desktop for the patient that is in context. If you are selecting a patient from the daily schedule, double-clicking on the patient's name on the schedule will also open their clinical desktop. Double-click on our patient to view their chart now. In the next chapter, we will discuss the Patient Profile dialog box. This chapter will introduce you to the Patient Profile dialog box in AEHR. In this short chapter, we will discuss how to set chart alerts for patients, how to review patient demographic information, and how to view and add to the team of individuals caring for the patient. The Patient Profile dialog box is a screen that will tell you demographic information about a patient. To access the Patient Profile dialog box, click the lowercase blue I located in the patient banner below the patient's name. At At the top of the patient profile dialog box, you will see an FYI section. Per UK's legal department, this section should never be used by anyone for any patient. Please do not enter information into this box. Chart alerts may be added to a patient's chart to identify information that is important to know about the patient while they are in the clinic. Chart alerts should not be clinic specific, as everyone in every clinic will be able to see this information when they view the patient's chart. Chart alerts, once entered, will appear below the clinical toolbar in red text. This is true whether the clinical toolbar is floating, as it is on the daily schedule screen, or docked, as it is on the clinical desktop screen. To add a chart alert, click the Add Alert button. Here you will see some predetermined options for chart alerts. If you would like to select one or more of these options, click the checkbox next to the item that you wish to select. If you do not see the chart alert you wish to add, you may also free text one in using the Ad Hoc Alert free text box. Try to be brief when typing alerts into the ad hoc text box, as you want the chart alerts to be easily visible on the clinical toolbar. You may add as many chart alerts as you need. If you add more than will fit onto the clinical toolbar, then a drop-down arrow will appear at the end of the list of chart alerts. Click this drop-down to see the chart alerts that do not fit. Below the FYI box on the Patient Profile dialog box screen are a series of hyperlinks. These hyperlinks will move you throughout the rest of the screen. If you need patient demographic information, such as an address, phone number, or social security number, then that information is all visible from the demographics section. Demographic information can be reviewed from the Patient Profile dialog box but cannot be edited there. Any information that needs to be edited must be changed in APM. The Patient Care Team section of the Patient Profile dialog box is used to document all of the providers, agencies, and other significant people involved in the care of the patient. This may include family members, hospice workers, social workers, and more. Anyone on the patient care team list can be included as a carbon copy recipient of your notes or letters. To view the patient care team, click the patient care team hyperlink on the patient profile dialog box. If you wish to add a provider or an agency to the patient care team, click the Add Provider Agency button. From the window that appears, you can search by agency name or provider last name. Once you have found the provider or agency you're searching for, click the box to the left of their name, then click OK. This will add them to the patient care team list. Once a provider is added to the patient care team, you can select their role and relationship from the corresponding drop-down arrows next to their name. This will help others to recognize the role that individual takes in caring for the patient. In the next chapter, we will discuss the clinical toolbar and the ACI window. This chapter will introduce you to the clinical toolbar of AEHR. In this section of this video, we will discuss the functions accessible from the clinical toolbar. We'll discuss the quick chart and quick appointments, the Add Clinical Item or ACI screen, setting the patient location and status, and committing to save information that you've entered during the current encounter. The first button of the clinical toolbar is the quick chart button. This button will open a read-only version of the patient's chart. This can be helpful when you want to reference a patient's chart but you're not able to leave the screen that you're working on. The quick chart will open the patient's chart in a separate window, which will allow you to view the chart without having to open the clinical desktop. There is a small drop-down arrow next to the quick chart button. This arrow will give you access to quick appointments. Quick appointments will allow you to view all of the patient's appointments with any UK healthcare clinic in one location. The button next to the quick chart and quick appointments button that looks like a little blue man is the Encounter Summary button. This will show you a summary of everything that's changed in this patient's chart during the current visit or encounter. Information in AEHR must be manually saved as you are working on it. This process is called committing. When you commit information in AEHR, the Encounter Summary screen will appear. This will allow you to review everything you are saving before you decide to save and continue on with your work. You will know when there is information to be saved because the commit button on the clinical toolbar will turn yellow. Anytime you see the color yellow in AEHR, it means that you need to do something. Therefore, when you enter information into the patient's chart and see the commit button turn yellow, you will need to click it in order to save what you have done. The commit button does not have to be clicked every single time it turns yellow, but should be clicked often so that you don't lose what you've been working on. The heart icon on the clinical toolbar will allow you to enter patient vital signs. This will typically be done for you by the clinical staff in the clinic, but you may need to enter vitals yourself every once in a while. When you do, simply click the heart button and enter whatever information you need to enter. Vitals readings from the patient's last visit will appear below each entry box for reference. When you've entered the new values, click the OK button. The Add Clinical Item, or ACI screen, appears whenever you are adding clinical information to the patient's chart. The ACI screen can be accessed by pressing the P button, the RX button, the Beaker button, the Open Book button, or the CC Plus button on the clinical toolbar. The ACI is divided into two main tabs with a series of sub-tabs included underneath each tab. The History Builder tab is where you will enter patient history information such as active problems, medical history, social history, and allergies. This information may all be accessed easily by pressing the P button on the clinical toolbar. This will take you directly to the Active Problems sub-tab under the History Builder tab of the ACI. The next three buttons on the clinical toolbar, the RX, the Beaker, and the Open Book, will take you to the Orders section of the clinical toolbar. The RX button will take you to the RX sub-tab of the Orders tab of the ACI. This is where you will go to prescribe medications for the patient. The Beaker icon on the clinical toolbar will take you to the Lab sub-tab of the Orders tab of the ACI. This is where you will go to place a lab order on a patient. From this tab, you can simply click the RAD or PROX tab to place radiology or procedure orders like ECGs or sleep studies. More information on prescribing and placing orders will be covered in detail in a future video. The CC Plus button on the clinical toolbar will also open to the ACI, but this button will open the Chief Complaint subtab under the History Builder main tab. This is where you will enter the patient's chief complaint or their words describing what is wrong with them today, if there is a chief complaint for this visit. One of the nice features of the ACI is that although all 5 of these buttons on the clinical toolbar open to a different place in the ACI, if you click the wrong one, all you have to do is click the correct tab to move to a different location. It is not necessary to exit the ACI and click the correct button on the clinical toolbar. The left side of the ACI window will show you any problems, medications, orders, and allergies that have already been selected. This will allow you to see the already selected information without having to exit the ACI window. You may change the view of this left side of the window by clicking the full screen button and viewing the items as tabs rather than boxes. Remember that after clicking OK to exit the ACI window, any information that you entered is not saved until you commit the information. The patient's location and status are both set from the clinical toolbar. These fields, once set, appear on the daily schedule so that everyone can see them immediately. The patient location field indicates where within the clinic the patient is located. This information appears in the drop-down next to the PAT-LOCK identification on the clinical toolbar. This is typically set by the staff member who rooms the patient. However, if you feel you need to move a patient's physical location, then you do need to update this value. The patient's status is set from the status drop-down. This is where within the patient's appointment they are located. So, for example, are they ready to be seen by a provider? Are they at the checkout desk? Are they with the clinical staff, etc.? The specific status workflow is determined by each clinic, but typically each individual who has contact with the patient will know when it is their turn to see the patient because the person before them will have set the status to indicate that the patient is ready to be seen by them. Therefore, it is important to keep the flow moving, that you check the daily schedule to be sure that the patient is ready to be seen by you before you enter the room to see the patient, and that you change the patient's status when you leave the room to indicate to the next person that the patient is ready to be seen by them. The values available in the patient location and patient status drop-downs are determined by each clinic. Therefore, you will see the values in these drop-downs that have been selected by the clinic chosen as your site. This is one of the reasons it's important to be sure that your site is correct. Changing your site was covered in the first chapter of this video. The piece of paper with a plus sign next to it on the clinical toolbar is where you will go to start your note. We will discuss the details of starting a note in the next video. Now that you have completed video 1, let's see what you remember with a quick review. Earlier in this video, you learned navigation and basic terminology regarding AEHR. Can you identify the appropriate name for each part of the screen shown below? Click the names on the top of the screen and drag them to the appropriate area. The area in white on the left side of the screen is the vertical toolbar. toolbar. The tabs at the top of the screen are called the horizontal toolbar. The gray box directly below the horizontal toolbar where the patient information appears is the patient banner. In the upper right corner, you'll find the log off and lock buttons. The status bar is the small area at the bottom of the screen. And finally, the clinical toolbar is the sometimes floating toolbar where you add information to the patient's chart. Remember that if the clinical toolbar doesn't appear on this screen, you can click the Tools menu and select Show Hide Clinical Toolbar. Refer back to Chapter 1 of this video for more detailed definitions of each of these items. This concludes video number 1 in the AEHR for Providers series. Please remember that you must watch all of the videos in order and pass a competency to successfully complete this course. The next video in this series is video 2, which will discuss starting a note and documenting patient history.